Hello, my name is Travis Warman.
I'm Jovan Erfan.
And I'm Andria Boland. And for our senior project, we evaluated LGBT or lesbian, gay, bisexual, and transgender patient representation in pharmacy school curricula throughout the US. We have no financial or other disclosures. So this is an important topic for all healthcare professions because the LGBT community faces substantial health disparities, including higher rates of certain cancers, mental health disorders, alcoholism, and other substance abuse disorders. However, despite the need for various healthcare services, previous research has found that pharmacy schools dedicate less than 3 hours of LGBT-related content throughout their entire curricula, and the most commonly discussed topic is generally HIV. The purpose of our project was to characterize LGBT-related curricula, as well as to determine the curriculum chair's perception of the quality of their school's LGBT-related educational content. To do this, our methods consisted of a 14-item web-based questionnaire sent via email to the curriculum chair or the equivalent faculty from accredited colleges of pharmacy throughout the US. The questionnaire was meant to capture the quantity and the quality of LGBT curricular content at each school. All responses to the questionnaire were anonymous, and 2 follow-up emails were sent to non-responders during the 2-month survey period. The primary outcome for our project was the number of LGBT-related content hours in pharmacy school curricula, and there were several secondary outcomes, which Travis will discuss a bit further in the results.
Of the 137 accredited pharmacy schools in the United States, a total of 21 completed the survey. The average time spent teaching LGBT-related content in the entire curriculum was 3.38 hours across all schools. The average at public schools was higher at 4.09 hours, compared to private schools at 2.6 hours. Although there was no significant difference. However, this could be due to small sample size. LGBT-related topics most frequently taught by schools included HIV at 76.2%, barriers to accessing medical care at 57%, gender transitioning at 57%, sexually transmitted infections that are not HIV at 52%, and sexual orientation at 52%. While topics like alcohol, tobacco, or other drug use among LGBT people, coming out of the closet, sex reassignment surgery, LGBT adolescent health, mental health in LGBT people, body image in LGBT people, and unhealthy relationships among LGBT people were more likely not to be available to students. We then asked the curriculum chairs to self-rate their school's overall coverage of LGBT content. The categories were very good, good, fair, poor, and very poor. 1 school was rated as good, 7 schools were rated as fair, 6 schools were rated as poor, and 4 schools rated themselves as very poor. It should be noted that no school rated their coverage as very good. 13 of 21 schools included LGBT-specific content in their required didactic curriculum, while 7 did not, and 1 school abstained from responding. Of the total number of participating pharmacy schools, 11 were public and 10 were private. Next, we'll discuss our findings and implications.
The findings of this study are expected to have a meaningful impact by identifying gaps in pharmacy education and also areas for potential improvement, including but not limited to alcohol and drug use, chronic disease risk, coming out, adolescent health, mental health, and body image in LGBT people. Comprehensively educating healthcare professionals in the diverse needs of LGBT patients is imperative to ensure that health disparities are reduced and eventually eliminated. Limitations of the study include the low response rate, the short study duration, the limitation of surveys to ACPE accredited schools in the US, an assumption of full knowledge of curriculum by respondents, and an assumption of truthful and unbiased responses by respondents. In conclusion, the perceived quality of instruction as assessed by the chair of curriculum committees at ACPE accredited institutions across this country varied substantially. Further assessment of LGBT health content coverage in pharmacy curricula is necessary in order to get a fuller picture of what level of coverage is available currently. After further studies have been done, expansion should also be made as appropriate to address those needs and gaps in coverage.
If you have any questions about our project or any concerns, we can be contacted at our email addresses in the lower right-hand corner of this presentation. Thank you for your time today.